Welcome to Meet the Cohort. This is our standard disclaimer slide. The views expressed in written materials and publications and by speakers and moderators do not necessarily reflect the official policies of the U.S. Department of Health and Human Services, CDC, nor does mention of trade names, commercial practices, or organizations imply endorsement by the U.S. government. This slide displays learning objectives for today's webinar. Participants will learn where other Cohort 2 subrecipients are located, get an overview of the approaches used by the 3 Category A national organizations, and finally learn how to connect with other funded communities doing similar work on the National Implementation Initiative. In 2016, we have a total of 47 newly funded communities on this initiative. Last year, a total of 50 communities were funded under the National Implementation Initiative. Those 47 communities come from 3 separate national organizations. Those organizations are the American Heart Association, the American Planning Association, and the National WIC Association. Each of these 3 organizations has a different approach to public health, which we'll get into a little bit later during today's presentation. This slide shows a breakdown by organization of the number of funded communities that make up the total 47 Cohort 2 funded communities. So American Planning Association has 17 affiliates and chapters that have been added for the second year of this initiative. And American Heart Association and the National WIC Association each have 15 chapters and affiliates funded for the second year of the initiative. Each of you is currently working on either 1 or 2 of the 4 focus areas. Of course, the 4 focus areas are nutrition, tobacco and smoke-free environments, physical activity, and community and clinical linkages, which refers to access to care. Here's a pie chart that shows a breakdown of the 4 focus areas and the number of newly funded communities working on each of them. 38 of the 47 are currently working on nutrition programs. 19 of the funded communities on physical activity programs, 15 on community and clinical linkages, and only 3 of the sites working on tobacco and smoke-free environments. We thought we'd display a couple of maps to kind of get a sense for where folks are located, along with some interesting information that we pulled from the Community Commons website, which has a lot of interesting data. The American Heart Association has its own hub on Community Commons where folks can pull data and get needs assessment type information to help base their programs on real needs and real data. So this particular map shows adults over the age of 18 with a body mass index of 30. Of course, the darker areas on the map are areas where there are higher concentrations or higher prevalence of obesity nationwide, and lighter areas would indicate areas where the numbers are slightly lower. So the darkest areas in the, looks like the American South have a greater percentage of adults with body mass index over 35%. And then here's where we have folks on the implementation program working on nutrition programs. It's not necessarily a one-to-one correlation as far as obesity and nutrition, because obviously there are some other factors that contribute to obesity. But this just kind of gives you a display nationwide of where folks are located. The yellow dots indicate sites where National WIC Association subrecipients are located. The green dots are for American Planning Association, and red dots are for AHA sites. This map shows physical inactivity by county. This is 2014 data. And then here we have locations for folks working on physical activity programs. Red dots again are American Heart Association sites. And then you'll see green dots, which are American Planning Association subrecipients for year 2. And on this next map, shows data, locations where current smokers are, the prevalence of smoking nationwide, and the 3 communities that are focused on tobacco and smoke-free environments. As you will note, all 3 are American Heart Association chapters and affiliates. So we've got some folks in Nevada, Austin, Texas, and also Jackson, Mississippi. Here we've got a map of heart disease mortality by age, listed as the underlying cause of death. And we've got yellow dots indicating where National WIC Association subrecipients are located. It is of note that the subrecipients from National WIC Association are the only folks working on clinical and community linkages, which is, of course, building bridges between public health, healthcare, and community organizations to help reduce incidence of chronic disease and get medical care where needed. Okay, next up, Nicolette is going to go over approaches and differences in approach between the 3 national organizations.
Okay, so now you've gotten an opportunity to look at the overall map to see what the statistics look like as it relates to obesity, physical activity, and nutrition. And now what I want to do is transition and really look at each of the category A's and their approaches that they're using. So for American Heart Association, majority of the work that they're doing is working with local city governments to adopt healthy foods and beverage vending initiatives through all city-owned properties, as well as looking at worksite wellness communities to ideally designate fit-friendly communities, or I should say in this case, organizations or companies that are promoting access to healthy foods and adopting policies that are similar to and endorsing the American Heart Healthy Food and Beverage Guideline toolkits that they've developed. In that work, that provides them an opportunity to do focus on procurement, and that's looking at work sites, government sites, providers, hospitals, employees, the patients, their visitors, as well as looking at physical activity education. May that be, again, in the work sites, in public schools, working with teachers, parents, child care centers, looking at utilization in farmers markets, where you're looking at recipients who are using the SNAP program, where there is shared use as it relates to school students, and smoke-free initiatives, may that be populations at a whole, community colleges such as the students, faculties, and staff, looking at casino employees, and parks, beaches, and trails. So when we talk about the American Planning Association, a lot of their work is looking at, initiatives around community garden initiatives, healthy vending options, healthy food supply chains, looking at implementing complete streets and positive attitudes towards active transportation. And most importantly, how do we improve the protectionist experience as it relates to traffic? And then the development of a lending library resource is part of the American Planning Association's initiative. So for the National WIC Association, one of the key things that they're looking at is healthy corner stores and farmers markets, healthy restaurant menu options, and building, once again, that community clinical linkages, whether that be clinical providers or working with public health organizations, as well as community-based organizations to improve access to care. And one of the things that I didn't mention, but I want to be sure to allude to, the details for each of the category A, their hashtag is provided on the slide. So we encourage you to utilize those hashtags. Okay, so now let's talk about the details of these communities and what they're focused on. As Cheryl mentioned earlier in the beginning of this presentation, there is a handout that's provided, and it gives you the contact information for each of the Cohort 2 and their partnering national organization. So when we talk about tobacco-free environments, as we've mentioned before, there are 3 organizations that are focusing on that, and they're all affiliated with the American Heart Association. And of these 3 organizations, they're all focused on tobacco-free environments. So they're doing initiatives to ideally improve policy systems or environmental changes to reduce the utilization and availability of tobacco, and most importantly, increasing smoke-free environments. When we talk about community clinical linkages, as we've mentioned before, only the National WIC Association is doing this work, and they have 15 communities, as listed here on this slide, that are doing this, that is providing or focusing on this work. And as I mentioned before, the handout provides the details of each of and the contact information for the affiliates for Cohort 2. When we look at the risk factor of physical activity and which sub-recipients are doing physical activity programs, we have a total of 19 communities that are focusing on physical activity. And as you can see on this slide here, there's a nice variety of organizations that are focusing on physical activity, ideally to increase physical activity opportunities within their communities and or local environments. And last but not least, we have our last and final focus area, which is focusing on or looking at nutrition. And in this, there's a total of 38 sub-recipients, local communities who are focusing on nutrition. And as you can see, this is primarily the American Planning Association and the American Heart Association who are focusing on nutrition, but also recognizing when you're talking about community clinical linkages, there are some cross efforts as it relates to nutrition promotion. So recognizing that, those are the 38 communities.
Okay, and this is Cheryl again. One of the reasons that we are doing this webinar is to not only provide you contact information for those who are working alongside you, but also to provide an opportunity or some ideas for how you might be able to connect with some of the other funded communities on this initiative. This slide has 4 ideas or suggestions, the first of which is to find and contact others doing similar work. The directory, the PDF document that is listed in the handout section of the control panel has contact information for the other members of the cohort. So if you were downloading that, you would be able to see contact information for the other 46 communities in addition to yours that are working on this initiative. It lists their primary risk factor as well as a secondary risk factor. In some cases, it provides a description or information about the target community. Additionally, many of the Category A organizations have peer learning networks or opportunities for peer sharing or peer calls where you can learn from the first cohort of communities things that worked really well for them, things that they learned over the course of the year. You can also reach out to them to discuss some of the challenges that you might be having early on or over the course of the year. And they might have suggestions for ways to work through some of those challenges. Additionally, look for networking opportunities. There is a workshop coming up in New Orleans scheduled for April 24 through 27. This in-person technical assistance and training workshop is designed just for you, and it provides a great opportunity not only to connect with your new team and also staff at the national organization that you're working with, but it also provides an opportunity for you to get a chance to meet some of the other folks on the project since everyone will be there together. Finally, we encourage you all to share resources as you come across those. There are a couple of listservs for this project. If you come across a resource that you find particularly useful, please feel free to share that with others. The next 2 slides may look familiar to some of you who attended last week's webinar on tools and resources. This is a snapshot of the online, a snapshot of the bottom half of the page for the online group for subrecipients. There is a function called Group Directory, which will allow you to search for other people who were working on this initiative, whether it's Cohort 1 subrecipients or communities or Cohort 2 subrecipients and communities. By clicking on Group Directory, you can search by several fields. And assuming that folks have filled out their profile in great detail, it'll enable you to find folks either by location or by partial search on name, and in some cases you may be able to locate them by typing in a keyword related to either the target community that they're working on or the focus area that they're working on. So that's a very helpful feature. It'll bring up their contact information as well. When we're talking about sharing resources, the resource directory is an online repository for tools, resources, templates, tools, resources, and templates to help you build capacity, to help you learn more, to help you do your work a little bit easier. It has great information from a variety of sources, including Centers for Disease Control and Prevention, recommended resources from the Category A national organization that you work with, as well as Directors of Health Promotion and Education, DHPE, and SOPHE. The resource directory does not require any type of password. Anyone who has the URL for this page can access it and pull up resources using the categories that are listed to the left of the screen. But if you come across a great resource and wish to share it with others on the project, there is an option, and it's circled on the screen there. Just click on Submit a Resource. The registration process is a few short fields, including just name, email address, and then it allows you to either upload the resource that you've located or type in the URL for the location of the resource, and others can find it as well. So this concludes today's presentation. If anyone has any questions, Nicolette and I are happy to answer those. This last slide has the Partnering for Health hashtag, which we've been using to cluster information about the National Implementation and Dissemination for Chronic Disease Prevention Initiative. That's the hashtag that we've been using on Twitter and for social media. With that, I'd like to thank you for allowing us to make a presentation to you all today. If anyone has questions, please feel free to type those in the question box now. I'll give you guys a moment to collect thoughts. Otherwise, please don't forget to download the webinar slides and the directory that's located in the handout section of the control panel. Okay, and seeing no questions for today, we can go ahead and conclude today's formal presentation. If you think of a question later and wish to contact us, info@dhpe.org is a general mailbox. The messages come directly to me. I'm Cheryl. So you can type a question there if you needed to, or contact us about anything really. And with that, we will let you get back to your busy workday. Thanks for your time and attention this afternoon. Goodbye, everyone.